establishment of the TB Ad Hoc Committee in the Western Cape. At this point, honourable members, I would now afford the opportunity for those in chamber as well as members online to please introduce themselves.
Chairperson, good morning. Dan Plato, thank you.
Thank you very much, and thank you for being in chambers this morning, Honourable Plato. We have received, or rather, let me go online next. Members online.
Good morning, Chairperson, Member Van Vogel.
Good morning, Member Van Vogel.
Good morning, Chairperson. In the department, my name is Ayanda Barnes. Thank you and good morning.
Good morning, Honourable Barnes, and it's also wonderful to have you back. We would have wanted you to be in chambers, but it's wonderful hearing your voice. I'm sure that we'll see each other soon. And thank you for logging in, Member Van Vogel, from afar. I won't elaborate, but thank you so much. Honourable members, also allow me to welcome our guests and those that are following our session via live stream on YouTube. Members has introduced themselves. I'll give over to the department.
Good morning, everyone. Nikki van der Walt. I'm the Deputy Director in the Secretariat for the Provincial Council on AIDS and TB in the Department of Health and Wellness.
Thank you so much. Wonderful having you with us this morning as well, Ms. van der Walt. Thank you so much. Apologies received. The only apology is that of Member Kergo of the EFF. Colleagues, I will now, without further ado, give over to Ms. van der Walt to kindly present her part to the session this morning, after which we will then allow members to ask their questions pertaining to the presentation. You may proceed, ma'am. Thank you.
Thank you, Chairperson. Good morning, honourable members, and thank you for this opportunity to brief the Standing Committee on Health on the TB program in the Western Cape and also on the establishment of the TB Ad Hoc Committee or the TB Caucus in the province. So I will start by providing an overview of TB in the Western Cape using data from our public-facing TB dashboard. This dashboard was launched in September last year and is accessible on the Western Cape Government website. So from the dashboard, we can immediately see that TB in the Western Cape is not evenly spread, with some districts being more affected than others. We can also see that where we have higher population density, we also have higher number of TB cases. So in the Western Cape for the 12-month period between July last year and June this year, 46,119 cases of TB was diagnosed, with 3,683 diagnosed in the month of June. During this 12-month period, we saw 4,156 TB-associated deaths. And in this instance, we define TB-associated deaths as deaths that occur in individuals who have a TB diagnosis with no treatment success rate within the 3 years or with treatment success rate within 1 year. So if we look at the city of Cape Town, or the metro as we refer to it within the department, there were 25,655 TB cases diagnosed in the 12 months, with 3 sub-districts accounting for almost half, or 48% of all cases diagnosed, and that is the Tygerberg, Eastern and Western sub-districts. So Tygerberg includes Elsies River, Delft, Bellville and Belhar communities. Eastern is your Mfuleni, Macassar, Strand, Somerset West area, while Western includes Langa, Atlantis and Milnerton communities. In the metro, we saw 2,220 TB-associated deaths during this period. The picture in the rural districts is pretty much the same, with higher number of cases in sub-districts that have higher population density, especially in Cape Winelands and Garden Route. So 6 sub-districts account for almost half, or 49% of all diagnosed cases. These are your Drakenstein, Brede Valley, George, Langeberg, Witzenberg, and Theewaterskloof sub-districts. And you will note that out of these 6 sub-districts, 4 are in the Cape Winelands area. 1,936 TB-associated deaths were recorded in rural districts in this 12-month period. When we look at drug-resistant TB, we see that 1,820 cases of drug-resistant TB was diagnosed in the year July to June. In terms of the burden, a drug-resistant TB caseload mirrors the drug-sensitive TB caseload with a higher number of cases diagnosed in Cape Winelands and Garden Route. And in the metro, in addition to Tygerberg and Eastern, we also see higher numbers of drug-resistant TB coming through in Khayelitsha and Mitchells Plain. So there is a higher risk of death amongst patients with drug-resistant TB compared to drug-sensitive TB. And accordingly, we see a higher proportion of deaths amongst those diagnosed with drug-resistant TB. And in this 12 months, it was 413 out of the 1,800. So that's almost a quarter of all patients with drug-resistant TB resulting in death. So now we're going to take a brief look at the impact of COVID-19 on the TB program. So TB testing is done primarily in our primary healthcare facilities. And during COVID, with the lockdowns and the reduced mobility of people, people delayed getting tested for TB. So anecdotally, we have reports of patients presenting at facilities at a sicker condition and at a more advanced stage of TB disease. So empirically, we found two measures which can graphically illustrate the drop-off in TB diagnosis. And the first is the graph at the top of your screen. This is the TB positivity rate. So ideally, we want to see TB positivity rates less than 10% because this suggests that we are testing enough TB patients. If the number climbs higher, it means that we are not testing enough patients. So in 2020, the TB positivity rate climbed steadily to a high of about 20% and remained there up to March 2021. It dropped to 18% in April to September last year, ending at around 16% at the end of the year. And whilst we welcome the decline, it is still significantly higher than the single-digit target that we aim for, and is suggestive that we are not diagnosing enough TB patients. The second measure is the absolute number of tests that we've done. Sorry, back to the previous slide. And that is the table at the bottom of the slide. The drop-off in testing is quite apparent there, with almost 190,000 tests conducted in 2019, dropping off to 126,000 in 2020, and then a small decrease back up to 135,000 last year. So clearly, COVID has had a major impact on TB testing and diagnosis, and that is even more apparent when we look at the next slide. And what we are seeing here is, can you move to the next slide? Is the drop-off in TB diagnosis, which is the red arrows, during every COVID wave. So we can see TB diagnosis peaking, and so the black arrows are the interwave periods. But whenever there was a wave, we saw diagnosis dropping. So we acknowledge that we faced a big challenge addressing TB before COVID-19, but with the added negative impact of the pandemic on TB diagnosis and treatment, this infectious disease must be prioritized at all levels. And one way in which we can do that, which we as a province can show our commitment to addressing TB, is through the establishment of a TB caucus in the provincial parliament. So I will now go on to the second part of my presentation, which will speak to the establishment of the TB caucus. So what is the concept of a TB caucus and where does it come from? So the Global TB Caucus was co-founded by UK parliamentarian Nick Herbert and the then South African Minister of Health, Erin Motsoaledi, in 2014 at the first Global TB Summit. In 2018, the South African National Parliament launched the National TB Caucus by a resolution of Parliament, with the chairperson of the Portfolio Committee on Health in the National Assembly and the chair of the Social Services Select Committee in the National Council of Provinces acting as co-chairs. To date, more than 150 countries support the Global TB Caucus. In 2019, the South African National AIDS Council resolved that the TB caucuses need to be established at provincial level to promote leadership at all levels and shared accountability for the TB response. So last year, the Provincial Council on AIDS and TB, which is co-chaired by Premier Alan Winde and a representative from civil society, Professor Harry Hausler, resolved that the Western Cape would establish a TB caucus. And accordingly, in June of this year, the chairperson of the Standing Committee, Honourable Philander, submitted a proposal to Council for the establishment of an ad hoc committee on TB, and this proposal was duly accepted and recommended for implementation. In terms of information that we have received from the South African National AIDS Council, thus far, Gauteng, Limpopo, Mpumalanga, and Northwest have already launched their TB caucuses. So what is the TB caucus? It's a unique network of political representatives that work collectively and individually to increase progress against the TB epidemic at different levels. Members of the caucus adhere to the principles outlined in the Barcelona Declaration, which is to work across geographical and political divides in a non-partisan and inclusive fashion, to engage with civil society, communities, and all other stakeholders involved in the fight against the TB epidemic, and to confront stigma and social isolation associated with the disease. So as parliamentarians, caucus members play a crucial role in holding governments to account and in ensuring that commitments are delivered so that we can eliminate TB within our lifetimes. The structure of the Provincial TB caucus, in terms of its composition and placement, provinces can leverage their structures and decide on the composition and placement of the Provincial TB caucus. A recommendation has already been made that it be established as an ad hoc committee. The Speaker, Deputy Speaker, or Chair of the Standing Committee on Health, plus one additional member, can serve as co-chairpersons. Membership should be open to any parliamentarian from any political party, and no political representative can be excluded from membership of the caucus and participate in its activities. In terms of Secretariat support for the caucus, this can be provided via the Secretariat for the Provincial Council on AIDS and TB, which is myself, and what this support can entail is directly supporting the caucus in developing and implementing its work plan, as well as supporting a sustainable response through ongoing capacity building initiatives. So what can the caucus do? There are four main recommended domains in which the caucus can make an impactful difference. That is in the space of advocating for the allocation of budgets that are ring-fenced for TB, and that there is reporting on TB spending by the relevant public institutions. Advocating for public institutions to account on the implementation of the TB program, supporting and calling for legislation that enhances the TB response, and then speaking to constituencies as well as having a media presence about TB with the aim of raising public awareness, reducing stigma, and increasing knowledge about TB. So the South African National AIDS Council does propose some key activities towards the launch of a provincial TB caucus. And this is that members of the provincial parliament sign up as members of the caucus by signing the South African version of the Barcelona Declaration, that the provincial parliament formally appoints caucus members, and this can be done as a build-up to the official launch, that there is a debate in the legislature on the provincial state of TB, that there is an official launch of the caucus, and this could be on the same day as the debate, followed by an induction of members, and then as well as creating opportunities for the TB caucus to consult with civil society and build consensus in terms of our response as a province. So just in conclusion, I just want to say that as we rebuild in the aftermath of what has hopefully been the worst of the COVID-19 pandemic, because we know that COVID is not yet completely gone, there is a keen awareness of the many lessons that we have learned in responding to that epidemic, and there is a renewed commitment to a whole of society approach to addressing the most pressing health needs, including HIV and TB. So key priorities for the response must focus on the reintroduction of comprehensive care provisioning in line with the Department of Health and Wellness Resurgence, Recovery and Reset agenda, advocating for a strong focus on inclusive and flexible routes to accessing care, especially for persons living with TB, and then addressing the socio-economic drivers and social determinants of health, including the determinants of TB. And some of those drivers and determinants, like food insecurity, which leads to poor nutrition, which leads to compromised immunity, poor living conditions that are overcrowded with inadequate ventilation, lack of economic opportunities that place limitations on people's ability to access health services because they simply can't afford the taxi fare to get to the health facility, or they can't afford to lose a single day's wages to visit a health facility. These are the factors that impact on a range of health conditions, and addressing these will benefit society at large. So with that being said, I can only conclude by saying that a provincial TB caucus can play a critical role in furthering the goal of ending TB in the Western Cape. Thank you, members.
Thank you so much, Ms. van der Walt, for your valuable input this morning. I just noticed that we have another guest at the back. Ma'am, if you could kindly introduce yourself for the record.
Good morning, Honorable Member. I'm Akona Stemele. I'm the acting Chief of Staff in the absence of Dr. Newman and Minister Mbombo. Thanks.
Thank you so much. I did not recognize you there at the back. But thank you so much for being here this morning. We do appreciate. And indeed, as Mr. Or rather Ms. van der Walt indicated, the critical role that us in the legislature can play in furthering the goal of ending TB in the Western Cape in totality. Members, I do not see any hands online as yet. We are now in the question and answer session. I see Member Barnes. Honorable Plato, anything from your side? You would like to raise a question? Yeah, okay, sure. Then Member Barnes, I will now afford you the opportunity.
Thank you, Chair. Just a few questions from my side. The first one is with regards to the death rate. There has been a slide speaking about the death rate. What I wanted to check was that, what is that the number of annual? If so, can we get a breakdown of what's happening monthly and which districts are this? Because what one normally picks up TB is mostly, that's my assumption, I can be corrected on this one, is you mostly find TB in poverty-related areas. So I wanted to check this myth of mine. Is it factual or is it just something in my brain? And then the second one I wanted to check, Chair, you must bear with me, coming from a long leave, I'm a bit slow. The slides were so fast, I couldn't really keep up. Was the prioritization of the caucus. I think when the presenter was speaking, she said that this caucus will be prioritized and it's almost at the implementation stage. However, my question would be, I have interest, I've seen a slide also speaking on how it will be constituted since it is ready to be implemented. I've seen that political parties will be there, civil society, I think. My question goes now to NGOs and how will these poor communities be aligned into this caucus? My last question, Chair, would be on the role of the TB caucus. Also, I didn't get clarity. I was not clear as to what the role of us as a province. I think the slides were speaking on the national side that there's a TB caucus, and I wanted to know now, narrowing it down to us, what is our role as the province in this caucus? What is the aim? What are we actually looking at? What we want to do, Chair? I think I'm going to take a pause on that one. Thank you very much.
Thank you very much, Member Barnes. For your questions, I also just want to latch on to your first question in terms of the fatality rate. This service is available on primary healthcare level. And do you still find that at this day and age, I mean, irrespective of who you are, where you stay, you should have access to treatment? But I obviously do realize that COVID in itself made it difficult for people perhaps to get to their treatment or to take, I'm not sure. But in terms of relapsing, did you find that that contributed to the fatality rate? And what is the approach of the department in terms of addressing that? And does that even put now the department more back in terms of reaching those individuals that are in need of treatment? And how do you go about in reaching them and making sure that they are able to access and take their treatment as well? Honorable Plato?
Honourable Chair, thank you. Not a question from my side, more a comment. Reason why I'm not going to ask questions, because I understand what the lady is saying.
Yeah.
Fortunately for me, I'm a former chairperson of Centre Cape Town. And so I was intimately involved with the TB issue, so I understand the issues. I agree with the caucus. Also with political parties and that sort of thing, it gives, and NGOs, that is what we're talking about. You create a holistic kind of an approach, and I think that is what's needed. The discussion must never become political discussions and that sort of thing. They need to focus on the issues and to deal with the issues, because the issues on the ground in the communities don't pass the party you belong to. I think it is for all hands to be on deck and to deal with tuberculosis, because TB is a killer. But I think the positive side of treatment is if patients stick to the treatment, the official involved will know much more than what I know about it, then there is no harm. And I think then you can fully recover from tuberculosis. But I support any kind of initiative to deal with the issue at hand and to assist people. As you have said, the Honourable Chairperson, doesn't matter who you are, where you live, that sort of thing, your circumstances. But it is good for government to put up his hand and to say, we want to further assist the TB patients and TB fraternity to come up with new ideas and that sort of thing. Thank you.
Thank you very much, Honourable Plato, and it's always wonderful to have your input and your valuable skill and experience as part of this committee. Much appreciated. Ms. van der Walt?
Thank you, and thank you for the questions. I'll do my best to respond to them. In terms of the death rates, the numbers that I projected or presented were the annual numbers for the period July to June, July last year to June this year. We can provide a breakdown by month and district, but the data is also available on the Western Cape Government website via the dashboard that I displayed, so members can also interact with the dashboard to get the specific time periods and by sub-district information, but we will provide that to Ms. Jumps there as well, the breakdown by month and district. In terms of the alignment, the membership of the caucus, so the recommendation is that caucus members are parliamentarians, and that we would create platforms for engagement where the caucus can engage with civil society and NGOs to build consensus and have a coherent response to TB within the province, so that we create that alignment between parliamentarians, government and civil society. The role of the TB caucus, I spoke briefly to that in the 4 domains around advocating for ring-fenced budgets and also monitoring expenditure by public institutions related to TB, holding public institutions accountable for the programs that they implement, supporting or calling for legislation that can support the TB response, and then really engaging with constituencies and creating a media presence to raise awareness about TB, so becoming a public voice and TB advocates. In terms of the your question, Honourable Philander, the access to treatment and the relapse, so we do see approximately, firstly, 10% initial loss to follow-up rate. So that is 10% of clients who are diagnosed with TB are never started on treatment. So they don't come back to get their results, and so they are not initiated on treatment. And our current treatment success rate is at around 80%. So at least 20% of our clients are not completing their TB treatment. It is a lengthy treatment program, at least 6 months. And so often when patients start feeling better, we know how difficult it is even for ourselves to adhere to a 7-day course of antibiotics. So a 6-month treatment regimen is quite lengthy. So our clients do struggle. The Department of Health and Wellness is looking at strengthening measures to specifically address that. One of the innovations that's currently being piloted is the use of telehealth and telemedicine to follow up on our clients that are lost to follow up or dropping out. We also have contact tracers and the community healthcare workers who are feet on the ground in the communities, trying to bring clients back into care. And then also via our mobile services, trying to take services to the people where they are to make it more accessible. Yeah, thank you.
Thank you very much, Ms. van der Walt. Any other members that still need clarity on the presentation or question? Are you covered, Member Barnes?
Baba, thank you, Chair.
No other questions from your side?
No, Chair, I'm good, thanks.
Thank you very much, Member Barnes. I'm really satisfied with your presentation, and I'm very excited for what's coming and how we as parliamentarians would be able to play our part in combating TB in our province. So now it's actively working towards establishing
And launching.
launching the Western Cape TB Caucus. I think on that note, Ms. Van der Walt, but also the very important role that we will be playing in reviewing legislation pertaining to and how to pass that, obviously, and just advocating the services and the access thereof, and all of us playing our part in combating TB in the Western Cape. If there's any other further questions, we do not wish to keep you longer than you have to. We know that you have also other duties that you need to attend to. But thank you very much for your presence at the committee this morning. And we know that you are in close proximity if we should need any further assistance or guidance from the department side. So on behalf of the committee, thank you so much for availing yourself this morning.
And thank you very much for the opportunity once again.
Thank you.
Thank
We
you
look
so
forward to
much.
further engagements. Thank you so
Thanks.
much. Thank you very much, members. Ms. Jamke, any committee business that we still need to attend to? But before we go to the committee business, any resolutions or recommendations based on the session, members? Member Barnes, is there any further information that you would want to acquire from the department?
Actually, Chair, I just wanted to check. In the presentation, we were speaking of we are ready for implementation. I don't know if, as a committee, we'll be able to have an answer when is ready. I didn't follow up on that. If maybe we can get a synopsis of as to where we are and when we are expecting to have this TB caucus up and running. If we can get clarity on that, maybe a response on that from the department. Thank you, Chair.
Thank you very much, Member Barnes. There was engagement on the Provincial Council level, which filtered down to the Office of the Speaker and then to the committee itself, where we had engagements pertaining to this matter. But what I will ask Ms. Jamke, to just draw up that tracking document for members to take note of, from inception as well as to when we will be launching and establishing. Will that be in order?
All in order. Thank you, Chair.
Thank you, Member Barnes. Any other recommendations that you have?
Nothing from my side, Chair.
Thank you so much, Member. Honorable Plato.
No, nothing from my side. I think the presentation was quite straightforward. We
Yes.
understand what the department want to do. I think from our side, I just want to say we can support the establishment of a ad hoc committee, and we can just wish such a committee well. As I've said earlier, each and every attempt to remedy, to assist them is always welcome.
Yes, absolutely. We should all do our part, Honorable Plato, and on the cards is also for the committee to embark on a fact-finding mission as to where else this TB caucus has been established and functioning actively and successfully. So that will also be part of our tracking document to update members on where we are exactly. Honorable members, you also have as part of your pack our draft program. Yes. If you can please just have a look at the program of the Standing Committee and Okay, you will see it online as well. If you can have just a quick discussion, if you can throw your eye on it and just provide input, perhaps where you would want to move up or down in terms of our activities as the committee. We are today on the 29th of July, where we had the briefing. On the 3rd of August, members will remember that, yes, coming Wednesday, members will remember that we engaged the Kailicha District Hospital in February, the management this year. So that visit will be a follow-up pertaining to that engagement. And the 5th of August, we will have the department back. And you will also remember that the ad hoc committee is dissolved. So each portfolio committee now focuses on COVID-19 within their respective portfolio. And we'll have the Department of Health and Wellness back on providing us with an update. On the 12th, we will also have a briefing by the department in terms of the name change to Health and Wellness. And the 15th to the 19th, members will remember our last public engagement was in Mitchell's Plain, where we interacted with community members in that low vaccination areas. And that was in collaboration with public education and outreach, where we had a pop-up station at the venue. So we will continue with that during the week of the 15th to the 19th of August. The 26th of August, we've got an oversight visit scheduled to the Cape Winelands. The 2nd of September, we will also engage stakeholders in the province. The 9th of September will see us, God willing, in the Overberg district, where we will visit health facilities. In September, members, we also have an upcoming cluster visit week. And the 14th of October, we will embark on visits to the Saldanha Bay municipal area. October, we have a deliberation discussion on the annual report with the Department of Health here in Chambers. And the 12th to the 19th of November, should our submission be in order and approved and budgeted for, the committee will then embark on fact-finding mission to Kenya on their TB caucus, which is the largest in the world and the most successful and functioning. And the 25th of November, we will present our final draft regarding the establishment of the ad hoc committee. But Ms. Jamke, I think that date will move up as we now speak in terms of August. We will have that before we go to Kenya. We wanted to go to Kenya before we do the establishment, but because they have elections early in August, we won't be able to do that. So we will remain with the due date of establishing the caucus and launching it in August. November, we have deliberations on the adjustment appropriation bill. And then let's not go to 2023 as yet, if you don't mind, members. So we have quite a packed program. Members, if you do not have any input or amendments at this stage, you're more than welcome to peruse the program over the weekend. And please revert to Ms. Jamke back by this coming Monday at 4 o'clock in order for us to consider adjusting and amending our program. That is the part on the program. Ms. Jamke, did I miss out on anything else?
Anything more to that program? Otherwise, we will not have time to breathe, looking at all the other committees' programs as well.
I hear you, Member Plato. I hear you. So we did speak to the program. There's nothing else. Member Plato, thank you so much. Member Barnes, thank you so much for attending this morning's session. Thank you, Ms. Jamke, for all your wonderful work. To all our procedural staff, Mr. Daza, Normally, when I see him, I think it's trouble, but it wasn't any trouble this morning. Thank you also for your support, sir. Ms. Mary Ann Burgess, thank you so much for your support. Honorable members and guests, this meeting is now adjourned.
Thank you, Chair, and goodbye.
Refreshments in the members' lounge.
Yeah.